At the initial consultation, we aim to go through and review any previous testing that has been perhaps done by your previous physician in trying to understand why infertility exists, both for the female or male party. In some cases, it might be the very start of the journey. So beyond taking the patient's initial past medical, gynecological, and surgical history, we will then start with some basic testing. And that basic testing might be as simple as doing a test of ovulation, a test of tubal patency, and a semen analysis. Obviously, for some patients, they may have already done these tests, and we will review the results of these tests in detail, and very much then review the way forward to best achieve that pregnancy. For some patients, they may have actually already gone as far as doing previous IVF cycles. And obviously, that initial consultation will also include a detailed review of IVF as to exactly how that patient responded to the IVF stimulation, how many eggs were retrieved, what was the quality of the embryos available for transfer, and obviously reviews the underlying potential causes for failure. And in the event that further testing is needed prior to moving to another treatment cycle, that we explore this option so that we move forward after the initial consultation with a plan of action.